I'm Nagy from the European Commission, from DG Sanko, from the Innovation for Health and Consumers Unit. And I'm here today to talk about the European Innovation Partnership on Active and Healthy Aging, but also about the demography of aging in general and some of the European initiatives in the field. So first I'd like to talk about the why. Why is aging important, and going into some of the details about the demography. Then I'll explore what we are doing in the framework of the European Innovation Partnership and how. We all know that the population is aging, and we all know that it leads to serious problems like the lack of health professionals, the increase of chronic conditions, financial unsustainability. We all know the difference between healthy life years and life expectancy, and how aging leads to even graver health inequalities. But still, I'd like to recall a few facts to orientate the discussion in the coming days. One of the commonly cited figures is that the number of people in Europe aged over 65 will double in the next 50 years. That means that from the current 87 million, there will be in 2060 151 million people over 65, which is over 17% of the population. That roughly translates to 1 in every 5 persons. However, living longer doesn't necessarily mean living healthier. Currently, people spend 1/5 of their lifetime with some medical or disabling condition. But why is healthy life here so important? We need citizens to be healthy in order to be able to contribute to society, in order to be able to contribute to economy. Here you can see how life expectancy is going to increase from today, 2010 to 2060. But I think the more interesting part is the bars in green, which show the big differences between life expectancy and healthy life years. Here I would like to mention that there are very serious inequalities between countries and between regions of Europe. For example, women in Malta can expect to live 86% of their life in good condition, and men in Sweden can expect to live 89% of their life in good condition. These sound reasonably good figures, but if you look at the other end, women in the Slovak Republic, they can only expect to live 66% of their life in good health. That's a very low proportion, and also in the Slovak Republic, men can only expect over 70% of their life to be disability-free. This, of course, translates into social and economic costs and economic issues. So the total age-related spending, and there is some small error with the slides, I apologize, was 23.1% of the GDP in 2007. This includes the medical expenses, but also pension, unemployment benefits. This is foreseen to be increased by 4.75% of the GDP by 2016. And it's not just the money that is an issue. The health workforce is shrinking, and if you put it together with the increased demand, you can foresee a great lack of health professionals. 1 million less of doctors, nurses, and 2 million supporting staff is foreseen to be missing. But what can we do? These are really great challenges, and to overcome them, a whole paradigm shift is needed. These are also commonly cited concepts. To shift from a societal challenge to a major opportunity, to see aging not as an burden but as an asset, to transform the whole system of care from a proactive hospital-based approach, from a passive hospital-based approach to a proactive community care, and to look into how aging can drive new research and industrial development. But what is the European Union doing to to address this. In the framework of the Europe 2020 strategy, the Innovation Union was created. It looks for cross-cutting societal challenges like climate change or aging, and seeks to address them in a very broad and innovative way. The European Innovation Partnership on Active and Healthy Aging is one of the pilot projects of the Innovation Union. It is a new method of stakeholder collaboration. So what is the European Innovation Partnership doing? The overall aim is to increase the healthy life years of the European citizens by 2 by 2020. And not only this, we are aiming for a triple win for Europe. A win for the citizens to increase their health and quality of life, but also a win for the health and social system by transforming them and making them more sustainable. And last but not least, we are also aiming for a win for the EU industry, for new opportunities, growth and expansion. The Innovation Partnership is a pilot partnership. It is the first of its kind. It's a new stakeholder-driven approach to innovation. It is not a legislative instrument. It is not a funding instrument, but it focuses on bringing together stakeholders from every sector, from health, research, ICT, to join up resources, to bridge gaps, and to really focus on the whole area of innovation, from basic research to pilots, supporting the deployment of innovative solutions and scaling up. We have a view of innovation that's quite broad. For us, innovation is not just technology. It is, of course, technology. It's not just new findings in research, but they are also important. But it's a concept that covers systems, organizations, delivery models, and a whole cooperation. This slide is just to illustrate that the partnership really focuses on and builds on the work of the partners. The Commission only plays the roles of a facilitator. It's actually the partners and the regions that provide input to the overall target. But what are the concrete areas? These concrete areas were debated and discussed by the stakeholders in 2010, and through a series of roundtables and discussions, the following 6 areas were identified as ones that contribute to active and healthy aging, and as ones where there is sufficiently a lot going on the field that can create a critical mass. The partnership also deals with other areas of active and healthy aging, but these were identified as low-hanging fruits, areas that can be targeted today and see concrete results in the coming months or years. So the areas are better management of health, focusing on false prevention, preventing functional decline and frailty, promoting integrated care for chronic diseases, including remote monitoring, ICT solutions that help people stay independent and active, age-friendly citizen environments, and improving prescriptions and adherence to treatment. And now, the most interesting question, the how. I realized that a collaborative, innovative partnership is rather abstract. So I would like to show you the concrete methods and some concrete examples of the partnership. There are 3 ways in which stakeholders can engage in the partnership. The action groups are one of the drivers of the collaboration. These focus on the 6 specific areas that I have just mentioned. The reference sites is a network of regions of health providers that are already implementing innovative solutions, and they can demonstrate their efficiency in the ground. And last but not least, we have a marketplace. This is an online platform, and HIAS is actually one of the very active members there. To share ideas, to network, to put forward a project, and to look for information. I will first talk about the action groups. and then briefly mention reference sites on the marketplace for innovative ideas. We had an invitation for commitment last year in May, and we had a high number of applications, 261 projects and 54 reference sites. These came from across Europe, and these put forward concrete initiatives, concrete projects. I know that this is a scary slide, but this is just to show some of the actions that we have. Our stakeholders are working to develop early warning systems on poor adherence to treatment. They are developing guidelines, for example, for free sarcopenia, clinical protocols for the management of free interoperable databases of risk factors, of clinical trials, of economic evidence. A strong component of the work is to build network. There's also a strong emphasis on reforming care, to implement integrated care models, to redesign care pathways, or to work on the risk stratification of patients. We had a conference on the 6th of November, and these action groups put forward concrete plans. These plans focusing the activities on the deliverables and on how they would collaborate. I'd like to mention a few concrete examples. These are examples that work with us, and the reason why we have selected these is that they already have some data to show that what they are implementing will actually make a change. In the area of adherence to treatment, adherence to prescription and treatment, the Medical University of Warsaw is working on an adherence assessment tool to identify potential problems with medicine adherence. Their results show that they have been able to save 10 to 20% of the medicine costs per patient. They are working with 330,000 patients. Another initiative that works towards better adherence to treatment is the e-prescription system in Andalusia. They are rather well advanced. They cover practically the whole population of Andalusia, which is around 8 million people. And the estimated annual benefit is 57 million euros. In the area of functional decline and frailty, the two initiatives I'd like to mention is the improvement program in NHS Scotland, which is a part of the general reshaping care program, aiming for 17% reduction in the emergency hospital bed days rate. And they are doing an inspection, a targeted inspection for all the participating institutions to come up with concrete recommendation. The University of Cork is embarking on a 3-year study that will also show the economic consequences of dementia. One of the most interesting examples is the Basque chronicity strategy. The Basque region in Spain implements a strategy that works in different fields. And one of the fields is the stratification of the population. They have stratified the entire population, and so now when a patient goes to seek treatment, the doctor instantly knows his risk status and can give treatment accordingly. The overall strategy has resulted in a saving of 8.9 million euro, a figure that's rather convincing, I would say. And the last example I'd like to mention is from Greece, the e-health system that is supported by an IT application and resulted in improvement of quality of life, reduction of stay, and reduction of direct costs. So much about the action groups. One of the most interesting things is the marketplace for innovative ideas. This is a website, and this is to collect input from the stakeholders. But we are also working to provide interesting information, day-to-day news on EU issues, And we also have a dedicated site on EU funding, something I will talk about in a minute. And the last way of joining the partnership is the reference sites. We already have a network of regions from across Europe, and they are working now to assess themselves and to establish a rating system for their good practices. I have mentioned that the innovation partnership is not a funding instrument. However, we are working closely together with colleagues in the Commission on potential funding opportunities in the field of active and healthy aging. Today, and this is the period until the end of 2013, the three main and most relevant funding instruments for active and healthy aging is the 7th Framework Program, the Competitiveness and Innovation Framework Program of DG Connect, and the 2nd Health Program of DG Sanko. In addition to these, there are relevant priorities in structural funds, in the Ambient Assisted Living Fund, and the European Investment Bank is also financing projects in this sector. From 2014, many of these funding instruments will be renewed. The SIG will turn into COSME, the 2nd Public Health Program will turn into Health for Growth Program, the FP7 program will turn into Horizon 2020. This is going to be a major one, with 9 billion euros earmarked for health, demographic change and well-being. And of course, the cohesion policy will continue. On our website, we give an overview of these funding opportunities, but we also look for actual concrete open calls, and every month we issue a PDF compilation of these calls. Some of the current examples for the first semester of 2013 are a progress call, lifelong learning, inclusive adult education, and an FP7 capacities prize. Other new funding opportunities will be the public health program, the joint action on chronic diseases, but also a call for proposal, and an ambient assisted living program. If you're interested in these concrete opportunities, I warmly invite you to come to our marketplace, register, and you can explore in more details. Yes, just one scary slide that mentions that we are working closely on monitoring the progress, and we are working with the Joint Research Center. And in 2013, we will continue our work in the action groups and the reference sites. We are foreseeing a conference on prescription and adherence and a conference on prevention of frailty. And our next major conference of partners will be in November. And with this slide, I'd like to finish and just flash once more the website of our marketplace. And thank you for your attention.
Hi, my name is Maria Konolenko, and I am with the Science for Life Extension Foundation, Russian-based nonprofit. And well, I have a question about an elephant in the room. There was no single mentioning of science or research in your talk. So the question is, how are you going to achieve the goal if you're not looking at science? All the things that were mentioned, that's geriatrics, and that leads to extending not the healthy lifespan, but rather the illnesses and all the things that eventually would lead to illnesses. So the question is, why aren't you looking at basic research into the mechanisms of aging, into creating the ways of extending, of preventing the age-related pathologies? So what about research? Where is research in this whole picture?
That's a very good question. The short answer is that the European Innovation Partnership has a slightly different focus but there are other initiatives in the European Union that focus more on this. The partnership is a pilot partnership that explores this new way of collaboration. So, as I have mentioned, we were looking for the low-hanging fruits, for those areas where we can actually achieve something in the coming year or in the coming 3 years. And basic research is not necessarily one of them, although we have a lot of research organization in the partnership. On the other hand, the European Union has several initiatives. The FP7 is a framework research program that also funds basic research, basic scientific research. There is the European Research Council, which is actually focusing on basic research, even stronger towards the basic research part than the FP7, which also has some applied parts. Other funding instruments focus more on the deployment, such as the Public Health Program, which already explores some pilot projects. But the FP7 program, the European Research Council, they are very much into scientific research, which includes basic scientific research.
Just to continue Maria's question and your answer, actually, if you look at the current programs funded even within the FP7 or European Research Council, we may find very little on the basic research of aging. Probably no mention of biomarkers of aging and things like that. And also, I was wondering what is the proportion of basic research of aging within the forthcoming new and emerging technologies program. It seems not to be there either. So it seems to disappear from the horizon.
Well, we are working with our colleagues to promote the priority of healthy aging. But I have to say that yes, there are so many priorities, and the amount of funding and the amount of possible priorities are limited. So it is inevitable that there would be some programs where aging and research on aging is not a priority.
But you see, this is the priority with the population of Europe aging at such a rate as to reach almost 25% in the next couple of years. This should become the priority. How can it be not?
Well, we are working to make it a priority, and we are working to promote this collaboration. And we are hoping that by showing that an innovative collaboration can lead to results in a matter of few years, that will be a good case to invest more and to invest even more in projects that return on a longer time frame. And basic research is one of these longer investment projects. If you are interested in more, or if you have specific questions, I'd like to invite you to send a mail through the marketplace, because a colleague of mine is specialized on funding and funding instruments. And of course, from the top of my head, I can't really say the exact numbers and proportions. But if you have more questions, you're more than welcome to start a debate and discussion.
Sorry, now the mic is working.
We can maybe have one more question, and then, well, after, in the pause, we will have a bit more time for some more questions.
I have a short question. What do you think is caloric restriction? Is it a healthy aging? A caloric restriction, is it a healthy aging? Because caloric restriction is shown to probably to prolong the lifespan. But at the same time, caloric restriction decreases fitness in some cases. So can it be considered healthy aging if one consumes less calories?
That's a very technical question. I can answer by explaining our methodology on seeing what's active, what's healthy aging. We are working with some general indicators, and one is the healthy life years developed by Eurostat through a European collaboration. And this healthy life years indicator is actually based on the patient's self-evaluation of their health and their activity index. So basically, if they are active and they fulfill and achieve what they want in their life, private, working life, and they feel that they are not limited by their illness, we consider that active and healthy aging. I'm sorry it didn't particularly answer your question, but that's our basic approach.
It's probably not